So this video might help you in having a solid understanding of the dataset's features by explaining their description and relationship to chronic kidney disease. First, we start with blood pressure. Blood pressure is the force exerted by the blood on the artery walls. It is measured in mercury millimeters, mmHg. It is recorded as two numbers, systolic, when the heart beats, and diastolic, when the heart is at rest, when the heart is resting between beats. High blood pressure is a significant risk factor for chronic kidney disease and may cause long-term kidney damage. Conversely, chronic kidney disease may also result in a rise in blood pressure. Therefore, monitoring and regulating blood pressure is critical to lower the risk of kidney damage and the advancement of chronic kidney disease. Then we have specific gravity. Specific gravity quantifies the solid's content in a liquid, such as urine. It is a method for determining if the kidneys generate urine with the right concentration. A change in specific gravity may indicate chronic kidney disease at an early stage. When kidney function declines, the kidneys may be unable to generate urine with the required concentration, resulting in a fall in specific gravity. Measuring specific gravity may help identify renal function abnormalities early on. What is albumin? Albumin is a protein generated by the liver and present in the blood. Therefore, maintaining fluid equilibrium and moving chemicals throughout the body is necessary. When chronic kidney disease advances, the kidneys may be unable to effectively eliminate waste products from the blood, resulting in a buildup of waste products, including albumin. Therefore, a reduction in albumin levels in the blood may be an early indicator of chronic kidney disease and a symptom that the kidneys are not working correctly. After that, sugar, often known as glucose, is an essential energy source for the body. It is present in several foods and beverages and is also created by the liver. Chronic kidney disease may impair the kidney's ability to eliminate excess sugar from the blood, resulting in a buildup of sugar in the blood and an increased risk of developing diabetes. Therefore, chronic kidney disease development may be slowed by monitoring blood sugar levels and managing diabetes. Now, what are red blood cells? Red blood cells, sometimes called erythrocytes, are blood cells that carry oxygen from the lungs to the rest of the body. Chronic kidney disease may impair red blood cell synthesis, resulting in anemia. Fatigue, weakness, and a diminished capacity to accomplish everyday tasks may result from anemia. Chronic kidney disease patients whose anemia is treated will have a better quality of life. White blood cells, often known as pus cells, are blood cells that assist in fighting infections. Infection in the urinary tract, a frequent consequence of chronic kidney disease, may be indicated by increased pus cells in the urine. Therefore, measuring the number of pus cells in the urine may aid in the early detection and treatment of infections, decreasing the likelihood of additional problems. After that, we have pus cell clumps. Pus cell clumps, commonly known as casts, are clumps of pus cells in the urine. Inflammation or infection of the kidneys, a consequence of chronic kidney disease, may be indicated by pus cell clusters in the urine. Monitoring for pus cell clumps in the urine may assist in the early detection and treatment of kidney issues, hence minimizing the risk of future consequences. Bacteria is the next feature. Bacteria are microscopic, single-celled creatures capable of causing infections and other health issues. Bacterial infections are a frequent consequence of chronic kidney disease and may exacerbate kidney damage. Screening urine for microorganisms and immediately treating infections may lower the risk of additional kidney damage. Also, we have blood glucose random. Blood glucose random monitors the blood sugar, glucose level at any time, not only after a meal. The role of blood glucose random in chronic kidney disease: elevated blood glucose levels may increase the likelihood of developing diabetes, a significant risk factor for chronic kidney disease. Monitoring blood glucose levels may aid in the diagnosis and treatment of diabetes, hence minimizing the risk of kidney damage. The next one is blood urea. Blood urea is a byproduct of the body that the kidneys eliminate. A rise in blood urea levels may suggest a decline in renal function, since the kidneys cannot adequately remove waste materials from the blood. Monitoring urea levels in the blood may aid in detecting changes in kidney function and tracking the development of chronic kidney disease. Now, what is serum creatinine? Serum creatinine is a byproduct of muscle metabolism that the kidneys eliminate. A rise in serum creatinine levels may indicate a decline in renal function, since the kidneys cannot adequately remove waste materials from the blood. Therefore, monitoring blood creatinine levels may aid in detecting changes in kidney function and tracking the development of chronic kidney disease. Sodium. Sodium is a necessary element for fluid balance and blood pressure maintenance. Chronic kidney disease may impair the kidney's capacity to eliminate excess sodium from the blood, resulting in elevated sodium levels and blood pressure. Chronic kidney disease development may be slowed by monitoring salt levels and regulating blood pressure. One of the critical features in the dataset is hemoglobin. Hemoglobin is a protein in red blood cells that carries oxygen from the lungs to the rest of the body. Chronic kidney disease can affect the production of red blood cells, leading to anemia and a decrease in hemoglobin levels. Anemia can cause fatigue, weakness, and a decreased ability to perform daily activities. Treating anemia can help improve the quality of life for individuals with chronic kidney disease. What is packed cell volume? Packed cell volume, PCV, measures the percentage of red blood cells in a blood sample. A decreased packed cell volume can indicate anemia, a common complication of chronic kidney disease. Therefore, monitoring packed cell volume can help detect and treat anemia, improving the quality of life for individuals with chronic kidney disease. Blood cells and red blood cells. White blood cells, also known as leukocytes, are cells in the blood that help fight infections. An increase in white blood cell count can indicate an infection, a common complication of chronic kidney disease. Monitoring white blood cell count can help detect and treat infections, reducing the risk of further complications. Red blood cells, also known as erythrocytes, are cells in the blood that carries oxygen from the lungs to the rest of the body. Chronic kidney disease can affect the production of red blood cells, leading to anemia. Anemia can cause fatigue, weakness, and a decreased ability to perform daily activities. Treating anemia can help improve the quality of life for individuals with chronic kidney disease. What is hypertension? Hypertension, also known as high blood pressure, is a condition in which the blood pressure is consistently too high. Hypertension is a significant risk factor for chronic kidney disease and can damage the kidneys over time. On the other hand, chronic kidney disease can also cause an increase in blood pressure. Therefore, monitoring and controlling blood pressure is essential to reduce the risk of kidney damage and the progression of chronic kidney disease. Diabetes mellitus and coronary artery disease. Diabetes mellitus is when the body cannot produce or properly use insulin, leading to high blood sugar levels, glucose. Diabetes mellitus is a significant risk factor for chronic kidney disease and can damage the kidneys over time. Monitoring and controlling blood sugar levels can help reduce the risk of further kidney damage. Coronary artery disease is when the arteries that supply blood to the heart become narrow or blocked, leading to chest pain, angina, heart attack, or other heart problems. The same risk factors, including high blood pressure, diabetes, and smoking, cause coronary artery disease and chronic kidney disease. Treating coronary artery disease may lower the risk of chronic kidney disease or halt its course if it has already been established. Next is appetite and pedal edema. Appetite is the urge to consume food. Chronic kidney disease may result in a lack of appetite and weight loss, hurting overall health and quality of life. Chronic kidney disease sufferers may improve their nutrition and general health by monitoring their appetite and getting treatment for any underlying problems. The accumulation of fluid in the foot and ankles causes pedal edema. Pedal edema is a frequent consequence of chronic kidney disease, and it may be caused by impaired kidney function or other underlying diseases. Keeping an eye out for pedal edema and getting treatment for any underlying reasons will lessen the risk of future difficulties. The last one is anemia. Anemia is a condition in which the number of red blood cells or hemoglobin levels drops, resulting in a diminished capacity of the blood to transport oxygen. Anemia is a frequent consequence of chronic kidney disease and may result in weariness, weakness, and a diminished capacity to perform everyday tasks. Chronic kidney disease patients whose anemia is treated will have a better quality of life.